Ladies, you asked and I listened. After my last video where I talked about how to wash your vaginal and vulval area properly, my comment section absolutely exploded, and I mean that in the best possible way. So many of you came back saying, Dr. Katie, this was helpful, thank you very much. But some of you were inquiring about your specific situation. Some talked about the fact that they were getting recurrent infections down below. Many of you asked, what if you have a vulval condition? And the technique that was discussed doesn't necessarily work for all because of different vulval conditions that exist. And honestly, all of these questions were so valid and they stopped me in my tracks. Because knowing the basic is one thing, but what happens for those of you ladies whose vulva behaves a little bit differently and definitely needs more than just the basic? That's exactly what I'm going to address in the video today. Hi ladies, welcome back to Hey Doc. We love all things to do with women's health, women's well-being. We look at fertility medicine and we are also passionate about antenatal care. So if those areas are your thing, be sure to subscribe and share. And so in the previous video where we talked about vulval, vaginal, feminine hygiene, we covered the fundamentals. I explained the difference between the vagina and the vulval area. I put a huge emphasis on the fact that the vagina cleans itself and that there was no need for douching, no need for special concussion to be inserted into the vagina through a vaginal douching item. And I looked at how this practice is actually harmful for the health of the vagina because douching affects the natural balance of the vaginal flora. I will leave a link to that video in the description box for you to go and watch and make a reference to, because that video is going to be the foundation of what I'm going to address in this specific video. Now, here's a truth that doesn't get said often enough. Not all vulval areas are the same. And what has become apparent through all of the questions that many of you were asking me is the fact that your vulval need will depend on the skin type within your vulva. It will also depend on your hormone balances, your age, and one that many overlook, your past medical history. So I will be walking you through the different vulval conditions that there are, and along with these different vulval conditions, I will be making recommendations of specific products that you can use to wash your vulval area and to look after your vulval skin despite having those conditions, which should relieve some of those symptoms that you are experiencing as a result of having those different conditions or those different vulval skins. The different types of vulval condition or vulval skin types that we're going to look at include the itchy, red or irritated skin type, the dry vulval skin. Then of course, we're not going to forget the normal balanced skin type. We're going to help our ladies who have a vulval area that is prone to ingrowing hairs or folliculitis. And I'm going to throw in a bonus, and that is going to look at ladies who have situation with recurrent bacterial vaginosis or very strong odors coming from the vulval area. I'm going to tell you what you can wash your vulval area with that will reduce the episodes of this happening. And if you are a lady who's suffering from recurrent bacterial vaginosis or is having issues with very strong vulval smell, I'm going to tell you what you must address with your doctor that will give you access to the treatment that you need in order to prevent this from reoccurring. Also, remember ladies, this video is for all age groups. So from the teens all the way to our senior ladies, this video is appropriate. Now, ladies, before you start using these products that I'm about to mention for an itchy, red and inflamed and irritated vulva, you must make sure that you've ruled out any medical condition, the most common one being thrush. But there are other medical conditions that will give a itchy vulva. And so if you have these medical conditions and you go ahead and use these products without ruling out these medical conditions, it will be counterproductive. These products will not address the underlying reason why you are having an itchy vulva. So make sure if you have an itchy vulva, you have been given a diagnosis by the doctor, or you have been thoroughly investigated by your doctor, and your doctor has told you, look, there is nothing. We have literally investigated you for everything. We've examined you. We cannot find anything. And in some cases, you may even have to have a biopsy. That means part of the skin is removed from the vulval area, looked at under the microscope to rule out any other medical condition. Once this has been done and you have been given the all clear, then and only then could you consider some of these products that I am discussing. This will be the same for all of the other skin types that I'm going to talk about in this video. Make sure that you have ruled out any medical condition causing you to have this skin type in your vulva and the resultant symptoms that you're getting from having this skin type. Because what you do not want to overlook is having a vulval cancer, something significant like a vulval cancer, and that you continue to treat with all of these wonderful products that I'm going to talk about, forgetting that, hey, this might be more sinister. This might be something that I need to address with medication, like a steroid or a pessary put in the vagina, or using an antifungal cream. That's when you have a medical condition that has been diagnosed. So this is an important disclaimer. So before using these products that I'm going to be talking about in this video, make sure you've done your due diligence and you've seen your doctor and you have ruled out any underlying medical condition that must be treated medically with pharmaceutical medications. A lot of these products that I'm going to talk about in this video are not pharmaceutical. They are mainly feminine wash self-care. Here on Hey Doc, we are wise ladies and we do the right thing medically at all times. Okay, red, itchy, irritated vulvar skin. Or some people would have been told by their doctor that they simply have sensitive vulval skin. This is where I will place a lot of women who have just given birth in this category of red, itchy, irritated vulval skin, because their vulval area as well as their perineum, which is the area between the vagina and the anus, these areas have just been stretched by the child going down the birth canal. So women who have just given birth are also found within this category. And another group of women that is found within this category are our ladies who are going through the perimenopause. Why? Because their vulval skin has become thinner due to the hormonal changes and the reduction in the amount of estrogen that they have. So of course, as a result, the skin is very fragile, it's prone to irritation and inflammation. Before I talk about the different products that I will recommend, I will say that in this video is purely for the interest of you lady watching this video. There is no sponsored content. I'm recommending these products because I genuinely believe, knowing what I know about the content of these products and the different types of vulval health, they will be good for you. So no personal gains here, just evidence-based information that you deserve. The product I recommend for a red, itchy, inflamed or irritated vulval skin area is number one, the Child Farm Wash. Yes, it was originally designed for children, but this dermatologically tested product is completely fragrance-free and is extraordinary in being gentle on the skin and is totally appropriate for this type of vulval skin. A lot of patients who have very sensitive, delicate skin swear by this product. It's an American product and its availability will depend on which country that you're living in. It's definitely available to get online. Another product that I would recommend is Yes Wash. This product is not only certified dermatologically, but it's organic as well as being pH balanced. It's a purpose-made wash which contains aloe vera and vitamin E. It is also fragrance-free, which is beneficial for very sensitive vulval skin area. This product kind of also crosses the barrier into dry vulval skin area. So it's helpful for those of you who have this current vulval skin type that I'm talking about, but also have dry vulval skin area. And believe it or not, plain water. I mean this sincerely. For truly reactive, sensitive skin, inflamed skin, there is nothing safer than water. Using lukewarm water put into the opposite hand and this water being run gently through the vulval area. No product at all. In fact, I would say that if you have been suffering from this kind of skin type in your vulval area for many years and you have gone from product to product and nothing has worked, literally nothing has worked, but you have not considered just using water by itself, I would suggest that you start all over again. Start with water. Be consistent at using the water for 4 to 6 weeks. I would argue that after this time, if you're not experiencing a soothed vulval area, then you can try the previous 2 products I mentioned. Listen, just using lukewarm water in the vulval area is a preliminary choice that dermatologists and gynecologists support. Now, if you have this type of vulval skin, there are some things that you must avoid completely. Avoid anything that is fragrance. Avoid any products that contain sodium lauryl sulfate or any other form of artificial fragrance or coloring. Ladies, check your labels. Now, onto the next vulval skin type, which is the dry skin type. Dry vulval areas can feel papery, sometimes like scrap paper. They're extremely sensitive. They can either be quite thin, or if it's been dry for a long time, the skin might be thick. A dry vulva can occur at any age. Some ladies have been unfortunate to have experienced a dry vulva their entire life. However, a dry vulva is more common in perimenopausal women and women who have gone through the menopause. This is due to the drop in the level of estrogen that occurs in this age group. Having a dry vulva can give you symptoms like a sensation of tightness in the vulval area, irritation, and would you believe that having a dry vulva can lead to itchy symptoms. So I know we looked at itchy vulval skin types before, but this time it's the dryness that gives itching. It's the dryness that appears first, and after having experienced a dry vulva for some time, then itching develops. Now, which products should you use? Remember, after ruling out any medical cause of dry skin in your vulva, the type of product that is suitable for use in dry vulval areas is Yes Wash. I'm recommending this product twice because it genuinely works for sensitive and dry vulval skin areas. Remember, itching and irritation can exist by itself without the vulval area being dry, but in our ladies who experience dryness, itching is often a symptom that they experience as a result of being dry. So itching will develop after dryness would have appeared first. The fact that Yes Wash is aloe vera based, it's really helpful because it allows rehydration of the vulval area without being occlusive. The next product for this type of skin is Dermal 500 lotion. Dermal 500 lotion. This is a medically graded emollient that is often promoted as a soap substitute. So I've treated many patients who have experienced eczema who have said, you cannot use any soap. You must use Dermal as your soap substitute. Now, having said this, one of the very common causes of dry vulval skin in the younger age group is eczema. So using Dermal 500 lotion that many of you will know as an eczema cream that you apply to your skin, it's absolutely appropriate to use Dermal as a soap substitute in the vulval area. So for you mothers who have a girl that is going through her teenage years that is unfortunate to be suffering from extensive eczema in her vulval area, you can teach her how to put Dermal in her hand, use a little bit of water, either use it in her hand or the little cup that it can come with. Put the dermal lotion within that cup. Use a little bit of water and mix it into a lather where it's a little bit runny, and use that lather into her left hand and run it through the vulval area, massaging it into the skin. After feeling that the skin is moisturized enough, then she can rinse it off. She or you, if that applies to you and you have dry skin down below, you can now rinse off the dermal with lukewarm water. I would recommend that you leave the lather into the vulval area for maybe a minute or two to allow the skin to be hydrated before washing off. Leaving it on for a little bit is important because it allows the lipid protective layer to be left behind once the emollient lather is washed off. Dermal is readily available, especially in the UK. Epiderm ointment is another very suitable preparation for dry vulval areas. Similarly, it's a product that was originally designed for eczema eczema, but it's totally appropriate to use it as a soap substitute for very dry and compromised vulval skin. However, its downside is the fact that it's very thick, oily and occlusive. So you must ensure that you rinse it off thoroughly, otherwise you will be left with a very thick, greasy layer in the vulval area. But to be fair, for some of you, the vulval area is so dry that this is actually what you might need to bring you some level of comfort and the relief from the intensive itching that can sometimes result from a very dry vulval area. Both Epiderm ointment and Dermal 500 lotions are also available on prescriptions, but they can be bought over the counter at pharmacies. So if vulval dryness is something that you have developed later on in life, it is not enough for you to self-diagnose and say this is because you are perimenopausal or because you have gone through the menopause without having had a thorough examination by your doctor. Once you have discussed those symptoms with your doctor, for your doctor to make that diagnosis that you're experiencing these vulval dryness symptoms because of perimenopause or menopause. Remember, if you self-diagnose and actually that dryness is because of something more sinister, you have wasted time. Something to highlight: in an older age group, it is a red flag if the vulval dryness only occurs in a specific area, in a specific patch. You are experiencing new vulval dryness. That's a big red flag. We worry about something sinister like lichen planus, which can be a precancerous condition, or even vulval cancer. Okay, so a specific patch is dry, that's not normal. In perimenopause or menopausal presentation of vulval dryness, it's the whole vulval area that will be feeling dry, not just one area. One specific area, red flag. Doctor immediately. Now, for those of you who have been examined and it's been diagnosed that your symptoms in the vulval area is because of being perimenopausal, before you go ahead and try some of these products that I've just mentioned, it is important to be considered for topical estrogen. Remember, a drop in your estrogen level will give you a dryness in your vulval area, and using some of these products that I've just mentioned will just give you temporary relief. Whereas if you use topical estrogen or pessaries, which are vaginal tablets essentially, or Ovestin, these have been life-changing for a lot of perimenopausal women because they restore some of the estrogen that the woman has lost locally. So they are often a lot more effective than some of these products that I have just mentioned. So if you're perimenopausal on here watching this video, take home from this section of the video, see your doctor first. And once you've been diagnosed, the option for you is not these products that I've mentioned. These are mainly for the younger girls who have been, especially if they've been diagnosed with eczema in the vulval area. For you, it's local estrogen replenishing products of Vagifem, pessary or Ovestin cream that is going to do you more good than the products previously mentioned. Next, let's not take for granted our ladies who have normal, balanced vulval skin. If you have no particular concern with your vulval area, life is good down there. You just want advice on a daily, gentle vulval wash that keeps things clean without disturbing the natural vulval vaginal pH balance. Big congratulations, because you have a wide range of products to choose from. FemFresh Daily Intimate Wash. It's a gentle pH balance intimate wash and good for microbiome support. And those are the natural bacteria that should be living in the vulval vaginal area. FemFresh Daily Intimate Wash is great to support your natural vaginal flora when you have a normal vulval area. Being pH balanced, it's not its only advantage, and the fact that it contains soothing ingredients like aloe. FemFresh Daily Intimate Wash is one of the most common intimate wash products. But if you cannot get your hands on FemFresh for whatever reason, it's not available in your country, there is also one that is very similar to FemFresh, and it's called Lactaseed Femina Daily Intimate Wash. This wash contains lactic acid, which actually supports the natural pH, and it's very soothing for the vulval area. So if you've had a very rough day and you've sweated a lot down below, but you don't have any problems with your skin type in your vulval area, this is an excellent product to use. Or if you can't get your hand on Lactaseed Femina intimate wash, then Femfresh is the other alternative. It is appropriate to use a product called Canesten Dermatological Wash. This product was originally designed for fungal prone vulval areas. It has all of the good characteristics. It's gentle, it's pH balanced, it's a fragrance-free wash, and it's suitable for daily use even if you don't have an active fungal infection down below. It's readily available at most drugstores. The last product I will mention that for normal balanced vulval skin is called Balance Active Feminine Wash. It also contains lactic acid and glycogen, which supports the vaginal flora ecosystem. It does the same as the other two products that I have mentioned. With these products, you do not need to use a lot of it. Remember, the vulvovaginal area is a very, very delicate area that has a very narrow pH balance, and you do not want to upset it by using too much products, even though these products have been dermatologically tested and have been approved to be used in that area. Using too much of these products, especially if you're doing it too frequently, can still affect your pH balance below. So all that you need to do with these products is apply a quantity of a 5-cent coin in your palm, warm this quantity between your hands, and apply it gently to the vulval external skin only, and then rinsing it off. Final skin type that I'm going to look at is the skin that is prone to ingrowing hairs and folliculitis. This is the skin type that I'm going to talk about before I address the bonus, which is abnormal vulval odors and the condition of getting recurrent bacterial vaginosis. Now, are you a lady that shaves, waxes, or uses laser in your pubic area? If you have ever done this, you will be very familiar with ingrowing hairs, small red bumps in your vulval or pubic area or pubic hair area. Folliculitis is a condition in which there is inflammation of the hair follicle. This is such a common condition. Products that you can use if you suffer from recurrent ingrowing hairs or folliculitis in your pubic area or along the side, quite close to the vulval area. Fur oil. This is a cold product that is formulated to soften the hair and the skin in the pubic and vulval area. It reduces ingrowing hairs, and it is free from parabens and fragrance, as well as being free from harsh ingredients like MCI. So what you do, you apply a small amount of this oil to your bikini line and to your vulval area after you finish washing. It's available on their website as well as being available on Space NK. 10 Skin Lotion is another product. This is a topical liquid that is used in the pubic or in the bikini line after the hair removals, and it's used specifically to reduce the incidence of ingrowing hairs that is very common after shaving or waxing or doing laser. This one is a little bit different. Unlike the fur oil that can be applied to the vulval area, also this one is only applied to the bikini line, to the hairline along the groin area only. It cannot be applied to the inner labia or the vulval area or the vaginal opening or the vulval area. That's the labia majora, that's the opening of the vagina, that's the perineal area. All of this area should be kept well clear of the 10 Skin Solution. It is available online. Lactaseed Femina is back. Yes, you can also use Lactaseed Femina feminine wash when you are experiencing recurrent ingrowing hairs or folliculitis. This is because the lactic acid that is found within this feminine wash is also mildly keratolytic, meaning it gently helps to prevent the skin buildup that occurs in growing hairs. So the conclusion that can be made is that using Lactaseed Femina wash together with fur oil is a great combination to prevent recurrent ingrowing hairs or folliculitis, most especially for you ladies that are keen pubic hair bikini line shavers. A word of caution though, if you experience recurrent folliculitis, inflamed pus-filled spots in the pubic hair area, please see your doctor, because sometimes the feminine wash and the oils, as great as they may be, will not be enough to treat this folliculitis, which often can become infected. So with infected folliculitis, vaginosis. The only thing that's going to get rid of this condition, so the red lumps or bumps, especially if it's become pus-filled, are antibiotics. And none of these wash will help if you have developed infective folliculitis, which can also be called an infective boil. Now, onto the bonus I promised. Recurrent vaginal odors are usually associated with infections. The most common infection that causes this fishy type of vaginal smell is called bacterial vaginosis. This bacteria is a sexually associated infection for reasons that we are not quite sure of. Women who are sexually active are the ones that tend to get bacterial vaginosis. Recent studies have shown that women who get recurrent bacterial vaginosis should be treated simultaneously with their partners. So we're not talking about, getting bacterial vaginosis the once and you've not experienced it again for a very long time. I'm talking about those of you ladies who have had bacterial vaginosis once, you've gotten treated. By the way, bacterial vaginosis can be confirmed with a high vaginal swab. It can be treated with oral metronidazole, 400 milligrams 3 times a day for a period of 5 to 7 days. That should get rid of that episode. If you're not keen on taking oral antibiotic to treat bacterial vaginosis, there is also an intravaginal preparation, which is with metronidazole gel that you will apply to the vaginal area again for 7 days, and that should get rid of those episodes. If it keeps coming back, remember it's a sexually associated condition, so it only happens in women who are sexually active. It has been found through recent studies that women who suffer from bacterial vaginosis episode after episode should also get treated with their partner, because whilst men may not experience any symptoms of bacterial vaginosis, they may be the carrier. So whilst you're going to be treated and you're getting rid of the episode, you're sleeping with your partner again, and that person is passing the condition back. Now, bacterial vaginosis is not the only condition that causes smells from the vagina. There's also the most obvious cause, which is poor hygiene. So if you're not cleaning down there, the buildup of bacteria, skin and slough will give a distinctive odor. So carrying out some self-care techniques that I've spoken about in my previous videos will be great help for you ladies if you've been a little bit slack with your feminine hygiene. But there's also a sexually transmitted disease called trichomoniasis. With this condition, you may get vaginal discharge. Now, this vaginal discharge may be subtle and you might just get a little bit of it, or you might get a copious amount of vaginal discharge. The discharge that happens with trichomoniasis is frothy, yellow or green, and can be of very distinctive smell. So if you've gotten the initial high vaginal swab and it's negative for bacterial vaginosis, you also need to be requesting that you get tested for trichomoniasis. So just because the swab for bacterial vaginosis, which by the way should not be done if you are on the medication, if you don't have the symptoms, the swab should only be done when you are actively perceiving that smell and when you're not on any treatment, because otherwise it will be negative, but it'll be a false negative because you are on medication. If the swab has come back negative for bacterial vaginosis, ensure that your doctor is also swabbing you for this sexually transmitted disease called trichomoniasis. It's very important to address trichomoniasis because trichomoniasis can lead to pelvic inflammatory disease that can lead to several fertility issues like blocked tubes and ultimately infertility. Trichomoniasis is treated with oral antibiotics, and once it's been detected, your doctor will tell you which antibiotic is suitable to use. That's it for this video. I hope I have done justice to your vulval health and that you now know, based on the type of vulval skin that you have, which products you should be using to clean your vulval area. That's if you must use a product to clean your vulval area when you have an active condition that is not responding to water alone. Remember, if your vulval area is nice and healthy and you have no condition, water, lukewarm water, run down the vulval area, and you cleaning and getting rid of all excess oils and excess cells from the vulval area still remains the #1 choice. But we know that this is not suitable for all women because they have different conditions in their vulval area. Do remember to comment, has this video been helpful? Do you have a specific vulval area type that I've not addressed in this video? Have you practiced some of these recommendations? Have you used some of these products that I've mentioned in this video? Have you had side effects? Have you experienced benefits from it? Has it not worked for you? We are building a community of women's health and wellness for women. Please comment, share, inform another woman, and let's support each other on our wellness journey.